I was very shocked to hear the results. I was between 99 to 100% blocked on my right coronary artery. I was basically a time bomb, and at any moment, any little thing, any exercise or any type of strenuous activity could have cost me my life.
Heart attacks doesn't always look like a heart attacks. Heart attack patients can present with indigestion, fatigue.
My name is Jennifer Cruz. I work here at GRMC as the Chief Nursing Officer. It's quite a busy and stressful job. Just recently, I started on my journey to get healthy, so I started working out and working on my diet. But prior to that, I had basically no energy, no exercise regimen. So I was just, go home and, eat dinner and that's about it. And the most activity I would do is clean around the house. I started to feel my symptoms right around the time when I started getting active in the gym. I would go to the gym and I noticed that I would feel this pain, like this kind of indigestion. It's just hard to describe. It's like this gassy pain, and it would go up this way and up my jaw, and it kind of felt like I was choking on something. The symptoms they would come and go, but it mostly happened with activity. Every time I would exercise, I would have that pain. Every time I would clean the house, I would have that pain. I was taking Tums, and I mentioned that, when I was talking to my husband, who happens to be a surgeon, and he was like, maybe you probably just need an antacid. I started taking Prilosec with the Tums, and still no relief. As a matter of fact, I remember sitting in a meeting with one of my directors, a pharmacy director, and I asked her, I said, hey, Angie, I'm taking Prilosec. Do you think there's anything stronger I can take? Because this indigestion, it's not going away. I know I'm taking the Prilosec, it's not helping me. I'm taking the Tums, and it's just, nothing's helping me.
Women may have a less classic chest pain. Sometimes they present with indigestion, nausea, vomiting.
And I remember laying in bed and asking my husband if I should go to the emergency room. Do you think I should go there, because maybe I'm having a heart attack? I wonder if I am. And he said, well, you're not having a heart attack. I said, well, tell me why I'm not having a heart attack. And he says, well, you're not having shortness of breath, and you're not you're not diaphoretic, you're not sweating. I went in thinking to myself, I'm going to have this CCTA done. It's going to be in and out, just like Bernice. He's going to tell me I'm fine, I'm not going to die of heart disease, and your heart is good. And I knew something was up when Dr. Gola messaged me and says, hey, can I go over your results with you? And I actually messaged him back and say, hey, I hope it's nothing serious. And he didn't respond to me, so that was one of the signs, I guess, that maybe he really, really needs to talk to me. Dr. Gola told me about the results, which he's basically told me that I was between 99 to 100% blocked on my right coronary artery.
Indeed, she has a severe blockage, close to 99% blockage in one of her artery called right coronary artery.
It really hit home when I saw my children. I saw my daughters, and at that moment I felt like, am I gonna die? Am I gonna make it? Dr. Gola just told me I'm 100% blocked. What if there's a complication? What if I don't make it off the table? What if something happens? Yeah, that was very, very scary for me. The procedure went very well. It's interesting because it's under conscious sedation, so you're kind of in and out. You're kind of awake, but you're not really awake. and I can hear all the what's going on and everything, but I can just hear how I can just, you know, these are all my colleagues, these are my nurses that I know and I work with, and I just feel like they did an excellent job.
Immediately we placed one stent and the blockage is opened with a one stent and blood flow is resumed, and she is chest pain free and doing very well.
After the procedure, it was interesting. I thought that I would be restricted and I wouldn't feel well, you know, because I was on, you know, they added a bunch of medications for me, and I felt that I was gonna feel sick, but I actually felt much better. I felt more energetic, and of course no chest pain or no epigastric pain or indigestion. I didn't feel any of that, and that was amazing. So I went home the next day, and it was just, it felt good. It just felt good to go home and to be healthy again. But the big thing that I needed to change was my diet. I can't, he suggested I go on a Mediterranean diet, and I started cardiac rehab, which is a requirement after you have a heart attack or after you have any kind of cardiac procedure. So I started that, and hopefully I'll get clear from that and I can just go back to my routine at the gym. It's important, I think, for people to advocate for themselves and don't ignore your symptoms.
Good news is, if you diagnose heart disease early, it is very treatable. Listen to your body, do not ignore the warning signs.